with coverage you can count on. This is WNAN TV5 News.
It doesn't surprise me when somebody that hasn't gone to medical school, that hasn't taken a bunch of science, maybe more than anybody else, has a conclusion like that.
A local doctor, the president of the American Medical Association, reacting to the Trump administration linking autism with the use of acetaminophen found in Tylenol during pregnancy.
He tells TV5's James Felton why the suggestion isn't just wrong, it's dangerous.
He stated as fact what is a hypothesis. Right, and that's just not the same.
Dr. Bobby Mukkamala talking about comments President Donald Trump made earlier this week about acetaminophen and autism. Trump said that evidence suggests that acetaminophen use in pregnant women, especially late in pregnancy, may cause long-term neurological effects in their children. He went on to say that scientists have proposed biological mechanisms linking prenatal acetaminophen exposure to altered brain development and adverse birth outcomes. Mukkamala, who is the president of the American Medical Association, tells me science is continuing to work to find the cause of autism, and that Trump's statement is more of a social opinion.
And that's just going to make somebody that, has a fever of 102 and they're pregnant. And they're like, you know what? I heard acetaminophen is probably bad for my kid and it's going to cause autism. I'm just not going to take it. 102 turns into 104. The 104 effect on the kid, let alone the mom, is disastrous.
Mukkamala points out that autism cases preceded acetaminophen.
Autism has been around for longer than acetaminophen has been around. So how do you say that's cause and effect when one existed before the other?
Mukkamala acknowledges that the number of autism cases have gone up over the years, but he says that's because the medical community is more familiar with autism now.
Rewind this tape 50 years. Where it wasn't as well known, a kid has a behavior issue and we say, you know what, that's just an attention deficit issue, right? That's a tantrum issue. And that's why they're doing it. But now science suggests something different, that it may be on the spectrum of autism. So what's the consequence? People that used to have this label now get this diagnosis.
Mukkamala says if you have questions about acetaminophen or anything else, talk to your doctor.
I'm glad that physicians and patients have a relationship that can help to sort of get rid of the doubt and the lack of knowledge and make our patients more knowledgeable so we can take care of things together.
James Felton, WNEM TV5.
The Michigan Department of Health and Human Services has also responded to President Trump's recent announcement that Tylenol use during pregnancy causes autism. In a statement, the department says the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine continue to support the use of acetaminophen in pregnancy when taken in moderation. You can read more from the State Health Department on our website, WNEM.com.